The Somerset Treatment Escalation Plan was many years in the making. Originally it was a paper form, and we digitised it to ensure that in places like this, rural places, that we had a single version of the truth, and we've now got well over 20,000 forms. What's most important about it is it gets to all parts of our health and social care system, into nursing homes, into people's own homes, and allows us in the background to do increasing quality improvement and involving the public in how the form looks and how it does what it needs to do in protecting people to get what they want and ensuring that we've got the right guidance when the most difficult days come for people.
The first SIDeR service went live in 2019. That was the Electronic Palliative and Care Coordination Service, or EPACS, followed by the Shared Care Record that went live in 2020. eSTEP was many years in the making, not because of the technology, but because of the change in the clinical ways of working that was needed to make it a success. As SIDeR Plus had already been live for a number of years, most providers had access and used it regularly, so making it the ideal platform to digitise the treatment escalation plan.
Excellent project management of the creation of eSTEP was crucial. We involved all clinicians and made sure that we had process maps to follow throughout the whole process. Having buy-in from our stakeholders was really important to make sure the eSTEP was comprehensive, useful for everyone.
SIDeR Plus is an API-based shared care record and forms engine, combining real-time data retrieval with persisted forms. Launched in context from applications in GP practices, Somerset Council, Somerset Foundation Trust and Margaret's Hospice and others, SIDeR Plus is a common view of information for health and care professionals. In particular, forms such as eSTEP are a consistent shared environment capable of writing data back into source systems.
But every time an eSTEP is updated or created, a copy is automatically sent back to that person's GP record in real time. This saves time and resource and avoids duplication of work across services, and it's a secure way of sharing information. From a patient perspective, they can be more confident that services understand their care wishes and that potentially difficult conversations are only undertaken once. The eSTEP is seen as best practice model of how digital tools can enable safer, person-centred care pathways.
Hello, I'm Dr. Matthew Dolman, a GP of 30 years experience in Somerset. The impact of the electronic treatment and escalation plan has been significant, primarily for the people, families and carers with whom this conversation happens in primary care. It enables that conversation to be captured and shared, and I believe undoubtedly impacts on people's quality of life and outcomes.
The eSTEP represents the latest stride in Somerset's 12-year journey from the black and white do not resuscitate form to a treatment escalation plan where treatments were discussed in the context of what a person could expect benefit from, to a person-led plan where, by listening to the person first, a reasonable expectation of benefit to that person in the light of what's important to them is digitally available to all who might have to look after this individual. A practical example of where an eSTEP has made a difference that I've seen was in a GP ambulance car where I was an observer. We were called to a house where there was an elderly lady there was a concern that she had suffered a stroke. In fact, she was clinically well, but the knowledge on the eSTEP that this person wanted to be cared at home, if at all possible, made it for a very easy decision not to send her into hospital and for her to be reviewed by her own doctor the following morning.
The adoption of the eSTEP across Somerset is a concrete example of how digitally enabled pathways can transform patient experience while reducing bureaucracy, as well as aligning closely with the 3 shifts valued in the 10-year NHS health plan. Patients are now assured their wishes will be known and understood by all professionals involved in their care, and by using one central platform for all organisations, we have ensured that it is recorded accurately in a timely manner.
With the No Barriers Here art approach to advanced care planning conversations, SIDeR and eSTEP facilitate timely and efficient documentation, promoting collaboration and inclusion. The eSTEP can be viewed across the organisation. The transcribe option, historic TEPs are uploaded. The edit option ensures timely changes related to the person's wishes.
Being part of the eSTEP team,
was really empowering. We made sure that all teams we went to visit knew how to use SIDeR and be able to access the eSTEP quickly and easily. This enabled better patient care throughout the hospital and onwards at the home environment too.
I quickly saw the value in the eSTEP. I have these sensitive, in-depth and hugely valuable conversations with my frail older patients regularly. Knowing this is shared with multiple agencies makes it so worthwhile, ensuring patients get the care and treatment they want and at the level they want in the future.
So the Somerset eSTEP, or the digital eSTEP, has been a major quality change for patient care. Just to exemplify, I recently had a patient who came in, an ambulance, was not feeling well at home, was smiling when I assessed him, and within the very next 1 minute when he got offloaded, had a cardiac arrest. I was very quickly, while I was still on his notes, able to assess his eSTEP home and knew that this patient had a DNAR, which was very recent as per his wishes. And we decided to not escalate this. No cardiac arrest calls went out. This was a time when we were in its black escalation in the hospital, and this step massively helped us to keep the staff focused on the areas that they were needed and not to pull them down here. But at the same time, it was kind of acknowledging that patient's wishes, and we did what was right by the patient. We phoned the family; they were happy as well, and I think that was really empowering for the patient, but it equally helped the staff as well.
I'm excited to be supporting the SIDeR Plus programme and seeing the positive impacts it will have for SWAS clinicians and their patients. Being able to access rich patient data while in rural areas or when out of hours, it allows us to deliver round-the-clock patient-centred care that's more personalised to them.
With the eSTEP now embedded in Somerset Foundation Trust, we want to focus on the quality of our treatment escalation plans. With the dashboard available to us, we can make a deep dive into individual patients and work on training and solutions to help improve the quality of these forms for our patients and their families to ensure they get the right care that's available to them.
Around 48% of Somerset residents live in rural areas. This rurality presents challenges regarding access to services, with many of the population living in areas with high geographical barriers. Somerset's population is also ageing faster than the national average, with over 25% aged over 65. Care plans such as eSTEP and advanced care plans are important, particularly for this demographic. The eSTEP is inclusive of all Somerset residents. Digitisation improves clinical practice and can be used for all patients regardless of background and helps share their key wishes.